What is monkeypox virus? What are the symptoms? Monkeypox virus is a virus that is found especially in Western and Central Africa and rarely causes infection. Monkeypox causes an illness similar to smallpox, a disease that has been eradicated throughout the world through global vaccination programs. Monkeypox virus is a zoonotic disease. Zoonotic diseases are transmitted from animals to humans. Monkeypox virus, monkeypox, is the causative agent of monkeypox, a rare disease. It generally causes a rash and flu-like symptoms. It is a member of the orthopox virus genus and the Poxviridae family, along with the variola virus, which is the causative agent of the much more widely known smallpox. Monkeypox was discovered in 1958 after 2 outbreaks of smallpox-like symptoms occurred among monkeys used for research. It is spread mainly through human-to-human contact of infected rodents, such as rats, mice, and squirrels. However, it can sometimes be transmitted from an infected person to another person through skin contact. There are 2 types: monkeypox virus, originating from Central Africa, and monkeypox virus, originating from West Africa. The virus that threatens to cause an epidemic in the world in 2022 is the less severe monkeypox virus of West African origin. Although monkeypox virus has been seen in Africa for years, it has occasionally been seen in other regions outside Africa. The monkeypox epidemic that occurred in the United States in 2003 was the first monkeypox epidemic outside Africa. This outbreak occurred through infected animals imported from Ghana to Texas. Infected rodents spread the virus to domestic dogs. Later, 47 people in the Midwest of America were infected with monkeypox virus. Infections, which were previously seen only in certain regions and were limited to that region, may spread to the world as international travel becomes more common. Monkeypox virus was detected in someone who traveled from Nigeria to America in the summer of 2021. Later, in the 2022 epidemic, cases were also seen in Europe, America, and Australia, apart from Africa. Monkeypox virus symptoms and signs. Anyone can become infected with monkeypox virus. Most cases in Africa have occurred in children under 15 years of age. It may take a few days or a few weeks after exposure for signs and symptoms to appear. Early symptoms of monkeypox are similar to the flu, and the following symptoms may occur: fire shake, headache, muscle pains, backache, fatigue and weakness, enlarged lymph nodes. A rash appears a few days after flu-like symptoms appear. The rash starts as red bumps that can be painful. These lumps then turn into blisters filled with pus. Then the blisters crust over and fall off. The entire process can take up to 2 to 4 weeks. Similar sores and rashes can also be seen in the mouth, vagina, and around the anus. Not all people infected with monkeypox virus will show all symptoms. In the 2022 epidemic, the normal process was not observed in most cases. In this outbreak, patients did not have enlarged lymph nodes, but only a few rashes and fever, although milder, were observed. Some people did not show any symptoms or signs, even though they were infected. It should not be forgotten that people with the disease asymptomatic can also transmit the disease to other people during long-term contact. The 2022 monkeypox epidemic is milder than other monkeypox epidemics. Currently, no deaths have been reported from monkeypox infection. However, it is known that in rare cases, the disease can cause pneumonia, encephalitis, or eye infections. Monkeypox virus is contagious. It can be transmitted after contact with people or animals infected with the virus. Transmission of the virus from animal to person can occur through contact with damaged skin, such as abrasions or open wounds, or through direct contact with the blood, body fluids, and debris of the infected animal. The risk of transmission of monkeypox virus from person to person is less. To spread from person to person, contact with an infected person's rash, respiratory droplets, or oral fluid is required. Although research is ongoing, there is no evidence that the disease is transmitted through semen or vaginal fluid. In addition, the disease can be transmitted by contact with clothes, bed linens, towels and laundry that have been in contact with a sick animal or human. Scientific studies continue to be conducted to gain information about monkeypox virus. Because monkeypox virus is an extremely rare infection outside of Africa, the rash may lead doctors to other similar illnesses, such as chickenpox or measles. However, enlarged lymph nodes can distinguish monkeypox from other diseases. To make a diagnosis, samples are taken from the rash. The sample is sent to the laboratory for polymerase chain reaction (PCR) testing. If the PCR test is positive, the patient is diagnosed. Ways to protect from monkeypox virus. There is no vaccine yet. However, it is known that the smallpox virus vaccine, which belongs to the orthopoxvirus genus of the Poxviridae family, like monkeypox, is also protective against monkeypox virus. Since smallpox was eradicated in 1980, smallpox vaccine is not included in current vaccination schedules. Smallpox vaccines are used only within the scope of scientific research. To protect against this virus, contact with infected animals should be avoided, and human-to-human contact should be restricted to limit transmission. Some suggestions to prevent monkeypox are listed below. Contact with animals, especially those that are sick or dead, should be avoided. Laundry and clothes that have come into contact with an infected person or animal should not be touched. All foods containing meat or animal products should be well cooked and should not be consumed raw. Hands should be washed frequently and correctly with soap and water. Contact with people who may be infected with the virus should be avoided. Safe sexual intercourse should be practiced, and condoms should be used. In places where there are crowded groups, a mask should be worn to cover the mouth and nose. Frequently touched areas should be cleaned and disinfected frequently. Personal protective equipment should be used when caring for people infected with the virus. Monkeypox is a self-limiting disease within 2 to 4 weeks. Most people do not need treatment, and the disease recovers without treatment. After the diagnosis is made, doctors evaluate the severity of the disease and follow the patient for signs and symptoms. If necessary, symptomatic treatment can be given. In treatment, it is often sufficient to give the patient antipyretics for fever, painkillers for pain, and antibiotics to prevent secondary bacterial infections. The patient should be prevented from losing fluid. Therefore, infected people are recommended to drink plenty of water. There is currently no established antiviral treatment for monkeypox virus. Antiviral treatment applications may help overcome the disease, but sufficient research has not been done specifically for the treatment of monkeypox virus. If you have complaints such as difficulty breathing, new onset or worsening chest pain, stiff neck, confusion, difficulty speaking or moving, loss of consciousness or seizure after contact with an animal or human infected with monkeypox virus, be sure to contact the emergency department of the nearest healthcare facility.